Thank you so much for joining us today. I was hoping we could start out with just a little introduction. Maybe you could tell me a little bit about yourself and maybe explain your job as a forensic nurse to me.
Sure. I am a forensic nurse working at South Peninsula Hospital, and I have special training in being a sexual assault nurse examiner and a forensic nurse, and I have 24 plus years of experience doing this work.
That's pretty phenomenal. So kind of just diving into some more questions, what do you think would be the ideal time for a person to make a sexual assault report?
I think that really if people should make it as soon as possible, because I like to think of part of my job is telling people what their options are, and they're going to have a lot more options on what they want to do the sooner they report.
Right. Cool. And can you explain the process of making a report? I know you said it kind of varies from situation to situation, but like how would people reach you or get to you?
They could reach us in a number of ways. If they chose to report to law enforcement first, law enforcement would then get a hold of us. If they chose to report maybe to women's services would get a hold of us if they wanted to have an exam. They can also call the hospital and ask to talk to a forensic nurse, and then we would call them back.
Awesome. Okay. And so if a teen made a report, what rights do they have in that situation as far as choices afterwards?
Well, with people that are under the age of 18, the choices are a little bit limited in that we are mandatory reporters. So even if the teen didn't want us to report, we would at least have to say that this happened to this person. But we're not going to call your parents. We're not going to necessarily alert your friends or anything like that. But we do have to make a call to law enforcement because that's state law. So that does limit your choices, but certainly you have the choice of whether or not you want to cooperate with the police. Some people don't.
All right. So why do you think it's important in your job that we teach consent in the classrooms?
Oh, I think it's hugely important because I think there's a lot of things. Some people grow up in households where there aren't really good boundaries. They don't really understand what consent is, or they've never had it. They've never seen it in their lives. So I think it's really important. It's important for us to establish that consent is one of the things that happens that has to be agreed upon by both people.
Lovely. Can you tell me something that you like about your job?
What I really like about my job is being able to spend a lot of one-on-one time with people and to have a huge impact on their lives in hopefully a positive way.
Thank you so much for joining us today to talk to us a little bit. I was hoping you could introduce yourself first and explain your job as a forensic nurse a little bit to me.
I'm Chris Fontaine. I'm a registered nurse. I work in the emergency department at South Peninsula Hospital, and I'm a forensic nurse. So what a forensic nurse does is work with people of all ages, from babies to elders, all genders, anyone who's been a victim of violence or abused or neglected. Some of my patients have been a victim of a crime.
All right. And when would you say the ideal time, and I know this is going to vary, but when would the ideal time be for a person to make a sexual assault report?
The ideal time for a person to make a sexual assault report is any time in their whole lives that they need to talk about that. We know that most people, if they've been abused or assaulted, they don't report. They don't necessarily tell anybody about it, much less law enforcement or a nurse or something. And so the best time to report is as soon as possible. Right. So as soon as it happens or right after it happens, ideally, it gives the person more options maybe about what might happen next. But what we know is that, most people don't report, or it takes a really long time. It's a delay in time between what happened and when they tell anybody. So based on that, anytime someone wants to talk about it, even if it's years later, is a great time to talk about it.
Awesome. And can you explain a little bit the process of making a report? How do people reach you or get to that level where they're talking with you about this kind of thing or getting that exam?
There's actually a lot of different ways that people can report. So a lot of us think about it like I would call the police and report, and some people do that. Some people report it to a friend or family member or teacher or coach or something like that, and then that person might tell someone else. Sometimes a person can come in and talk to a nurse and tell the nurse what happened. And if the person is under the age of 18, then, anyone who works with kids in that kind of way, they're going to be a mandatory reporter, and they are going to have to go and report that to law enforcement to make sure that we just do our best job to protect the child or the teenager. And that's the law. Even within that, that person still has choices.
All right. And you kind of told us before that the process can definitely be different for everyone based on a lot of different variables. Can you speak to that a little bit more about how that process might be different?
It really is different for everybody because it just depends on what happened to them and how long it took for that story to come out and how people respond to them. So we know that sometimes it's something that people are going to end up, talking to the police about, or having what's called a forensic interview where they're interviewed about what happened to them, but they aren't necessarily talking to law enforcement about it. They're talking about it to someone who's trained to really ask those questions in a way that can get the best information and make them feel most safe. What was your question again?
Just about how the process can be different for everyone.
So sometimes people, if something happened to them in their home or in their family, then child protection might become part of that situation. Sometimes people reported a crime and then maybe they don't feel like anything's happening to that investigation, and so they have a lot of questions or they wonder why or why not something is happening. What we know is that regardless of what actually ends up happening in that situation, having the chance and the opportunity to intervene and help protect that person is really what it's all about. So just the fact that that child or teenager or adult told someone what happened, it gives us a chance to help keep them safe. So we don't always know how that situation is going to end up, but we do know it's a chance to be there for them and believe them and listen to them and do anything that we can to keep them safe and keep that from happening again.
Awesome. So if a teen makes a report, what rights do they have as a minor? And will you ever make a person do anything they don't want to do, or what does that look like for a minor if they do come to you?
Every teenager, every child has rights. They're a little different than rights adults have. For example, if someone who was under the age of 18 told me that they had been hurt by someone, I would have to report that to, Child Protective Services or law enforcement. But everybody has the right to talk about what they want to or not. And as far as working with someone as a nurse, regardless of how old they are, everything that we do and everything that we talk about is going to be totally up to them. So even a little kid, I can ask them if it's okay, and they can tell me yes or no. And I take them at their word and I respect what they have to say. Same goes for a teenager or an adult. So any teenager or child, even if someone else is reporting what happened to them and they're not ready to talk about it, they don't want to talk about it, no one's going to make them talk about it, what we want to do is help them feel safe and protected, so that if they're ready sometime, that they will tell us what happened, and that will help us to keep them safer. But even if I'm seeing someone as a patient, I'm always going to ask them, no matter how old they are, if it's okay. All the way along the way, if I'm doing a checkup with them or an exam of some kind, they can be informed about what's happening, and if they're a little older, they can give me informed consent, which means that they're old enough to understand, and teenagers are old enough to understand when they get the information.
Right.
They can decide yes or no. Younger kids, maybe that haven't hit adolescence yet, they don't necessarily have the capacity to really understand everything, but they can tell you yes or no, and they can give you assent, they can give you permission. And so I always look for that. And even if someone has given me permission to do something, they can always change their mind later. They can take back their consent and say, I don't want to do this anymore. And then that's what happens, is we listen to what they want.
That's really important, I feel. And that kind of plays into my next question. So why do you think it's important in your job that we teach consent in the classrooms and such?
I don't think that most of us get taught that at all, ever. It's really about communication, and some of us have had families or teachers or friends that really do a great job of communication, and so everyone is listened to and heard. Other people don't have that experience. They don't have families or people around them that understand what it means to ask permission or give permission. And so it's really important, if people have been hurt or abused or assaulted in some way. A lot of my patients, they might not remember what happened to them if they were assaulted. They might have been given drugs, or they might have been using alcohol, and they really don't remember. So issues of being able to consent to something, they can be very confusing and very overwhelming. So if someone's talking to me, I'm going to make that a priority, that they understand that they're doing that because they can and they don't have to.
Awesome. So would a person ever have to talk with the police, a counselor, a doctor, anyone beyond you as a nurse, or does that kind of play into how it can be different for everyone, kind of?
It really will just depend
Right.
on kind of what's going on. But again, someone can decline to speak to someone if they don't want to. We always want to try to help people be as honest as they can be, and as safe as they can be when they're talking about something. So they won't be forced to do anything. But I might encourage someone
Right.
to talk to a counselor. I might encourage someone to talk to a doctor. I might help people understand that they have the option of explaining what happened to a police officer or something like that. But I will make sure that they know that they have a bunch of different choices, and one of those choices is to not talk about it at all.
Awesome. And finally, can you tell me something that you enjoy about your job, or that you appreciate about it?
I actually really appreciate my job. People pretty often will tell me, gosh, I don't know how you can do your job. It must be really hard to work around that kind of thing, or to work with people that have been hurt. And it is sometimes. But what we do is help people stay safe, and so that makes me feel great. That is something that we can do to prevent further things from happening. We know that the way we respond to people initially when they're very first telling their story and the history of what happened to them makes a huge difference on how they heal, and that makes a whole difference for them in their entire life of how what happened to them might impact them. So I feel really honored that I can be there at that time, and the way I respond to someone can actually change their lives because someone believed them. So I really get a lot out of that myself.
That's really powerful. Thank you so much for speaking with us. Is there anything else that you'd like?
Thanks for having me, and
Yeah.
thanks for doing everything you guys do.
Thank you.